Okay, this is the first installment of this chapter on psychological treatment of psychological disorders. Here are the learning objectives for this section. We'll talk about psychoanalysis. This is going back to Freud's ideas and also contrast it with Humanistic Existential Therapy. Talk about behavioral therapy, including exposure therapy and cognitive restructuring, which is part of cognitive therapy. And then we'll talk about group therapy and self-help at the end. So just to preface this, we're talking about psychological treatment right now, psychotherapy, for this video. So this is talking, this is people interacting with a clinician, and also using other factors in the person's environment to change their brain and behavior. We will talk later about biological treatments, things like pharmacotherapy, surgery, and brain stimulation. So here's kind of the outline. Psychodynamic therapy we'll talk about first, humanistic and existential therapy, behavioral and cognitive therapy. There's also cognitive behavioral therapy, CBT, which is a very common technique employed, and group therapy at the end. Okay, so first, psychodynamic therapy. Two types of therapy fall under this that we'll discuss: psychoanalysis and interpersonal psychotherapy. Psychoanalysis, this is after the style of Freud. It's the typical image you may think of when you think of psychotherapy, a clinician in a chair, in an armchair taking notes while a client is reclined on the couch talking about stuff. The point of psychoanalysis is to explore the unconscious. Remember, Freud was all about studying the unconscious, especially childhood influences on unconscious motives. This is typically a long process. It's frequent sessions held over a long period of time. And the focus is on developing a close relationship between the therapist and the client. This involves what's called free association, just saying whatever comes to mind. Even involves dream analysis, which Freud thought could provide kind of a window into the unconscious. Just as an FYI, there are these concepts of resistance and transference, which your textbook describes. Resistance is when a client is resistant to change and resistant, and kind of putting barriers up to changing as a result of the therapy. Transference refers to when the client makes the therapist a key part of their life. And my understanding is this is it's called transference because it's kind of transferring the relationship between the client and their mother figure in their childhood to the therapist. So the therapist kind of assumes that role in place of the mother. So there is evidence that it's not practiced as much, but interpersonal psychotherapy, which we'll talk about next, has been shown to be effective. But there isn't a lot of evidence to back up much value in digging deep into this transference and trying to overanalyze that event when that occurs, if it occurs. Interpersonal psychotherapy is similar in a lot of ways to psychoanalysis. It's still focusing on developing insight into the unconscious and building that strong relationship between client and therapist. But the focus is on current relationships. Therapists in this type of therapy may give advice rather than just allowing the client to freely speak and free associate. And this is typically done face-to-face, two people sitting each other maybe across a desk, rather than facing away on a couch. Humanistic and existential therapies, remember Rogers and Maslow. This is based on a different foundation, assuming that all individuals have good tendencies towards growth and they have this need to fulfill higher needs. The therapist is kind of there as a facilitator, facilitate that growth, showing understanding and empathy, and helping clients to develop their own goals and providing support for them in that process. Gestalt therapy is one type of existential therapy, and it's helping clients become more aware of their own thoughts and tendencies. The empty chair technique is one technique employed in Gestalt therapy, in which clients will face an empty chair and do kind of these role plays. If there's some relationship in their life that's of particular relevance, they may role play them speaking with that other person, and role playing how they would respond, and kind of playing out that conversation, just to help them become more aware of their thought process and their tendencies. Behavioral therapies. This is giving patients things to do rather than just having them talk through things, but giving them tasks. I'll post a link to this video. This gives you a feel for what an exposure therapy session would look like for somebody with OCD. You'll see somebody who's afraid of contamination and germs handling an old dog leash, and the therapist talking her through, like, tell me about the dog leash, and what do you think that stain is, and what do you think, and why do you think it's all chewed up there, and having her take the leash and not just handle it, but touch it to her face and her clothes and even her lips, really trying to evoke those feelings of anxiety associated with the contamination, but with the idea that with exposure to it, it'll lessen its intensity and will also become associated with no actual harm coming to the client. Behavioral therapies, there is a behaviorist influence here, kind of an Extinction. You probably remember Extinction. That plays a role in exposure therapy, breaking that association between a conditioned stimulus and a conditioned response. And sometimes this involves confronting these emotion-arousing cues. Sometimes it's done where you're actually touching and handling an object or confronting something in real life, and sometimes it's just imagining exposure, like if in PTSD, imagining the traumatic event in vivid detail, and even virtual reality has been employed. For example, veterans viewing virtual reality scenes related to a traumatic event that may have occurred. This also encompasses rewards and punishments, like a token economy, where clients are given rewards for good behavior. One example is contingency management for addiction, in which clients are given like little monetary rewards, like gift cards or things like that, for staying sober for a period of time. So cognitive therapies, two therapies we'll address that fall under this are cognitive restructuring and mindfulness meditation. Cognitive restructuring is facilitating clients changing their perspective of automatic beliefs and thoughts and predictions. Like maybe they feel that there's no point in continuing with schooling because they failed an exam and they think it's hopeless, and examining that as an automatic belief and having the client examine evidence for or against that. Yes, there's some evidence here that you failed an exam, but there's a lot of evidence against that you may not be thinking of, that you've been able to succeed previously when you've failed in other domains of your life, and that you're succeeding in your other classes, and this is just this is probably just due to maybe you didn't get enough sleep, or so helping clients to see evidence that refutes a certain belief that they may have that's influencing their behavior. Mindfulness meditation, this is a kind of an up-and-coming therapeutic technique that's gained additional popularity, more popularity over the past years, recent years. This is, again, restructuring thought processes, but it's learning to cope with unwanted thoughts in a non-judgmental way. This has roots in Oriental meditation practices. Also involves being fully present and aware of thoughts, feelings, and sensations. There are different variations of this. Mindfulness meditation typically involves focused meditation, focusing on the breath, just trying to focus attention on your breathing in and out, and if other thoughts cross your mind, to just let them arise in a non-judgmental way, but then shift your attention back to the breath. And with practice, this is there's evidence that this is effective, has some degree of effectiveness for things like addiction and chronic pain and other disorders. Cognitive behavioral therapy, as the name suggests, this is a combination of both cognitive therapy and behavioral. It includes cognitive restructuring, but then coupled with action, so you're given homework to do to implement behavioral interventions. And this is widely used, and it's been shown to be effective for many disorders. I'm going to go ahead and pause this recording and start a new one, and we'll talk about group therapies. So I'll conclude this one.